What's going on, everybody? This is Donnie Tudall, not with Beast Athletes for this conversation. We're going out for a little shoot right now, but I've been kicking around this idea of doing a video talking in very layman's terms about steroids, performance-enhancing drugs, and just kind of more background on them. We're getting a lot of different crazy stuff being thrown around on things that we post, and I just kind of want to inform some people what things actually do, what they don't do, and kind of maybe fix some of the fucking stupidity that is out there with it. So if you want to watch the full video, go check out our YouTube, and then we'll go from there. So the very first thing I want to say about this, I'm not sitting here saying, oh, you need to take steroids or performance-enhancing drugs of any sort or anything like that. I just want to give some information that I found myself and that I've kind of regurgitated into a less scientific, layman's, easy for everybody to understand way. So what I'm going to do is go through a handful of different categories, not a handful, 3 different categories really, and just kind of touch on the different things that fall under each category. But one of the biggest misconceptions is you can just take steroids and you're going to fucking blow up and get super fucking strong. That's not what it is. One of my friends was like, oh, I'm going to get on this stack and I can just chill out at home and I'll get bigger. I'll grow muscle. And I was like, no, you're false. You're totally wrong. You're setting yourself up for failure. And they started talking about how much of each thing they were going to take. And I was like, you're setting yourself up for fucking suicide. So let's really not do that. Steroids can be a very good thing in certain circumstances, but just like anything else, if you abuse them and take too much, it can really fuck you up. And that is not what you want to do, period, with anything. You can drink too much water and hurt yourself. So the most important thing to understand is you still have to put in the work. You probably have to work harder because what a lot of steroids do, they allow you to recover more, recover better, quicker. And if you can recover better and quicker, it also allows you to push yourself a little bit farther. But you have to be willing to take that extra step and go a little bit further than you would if you were going naturally. And, training smart, not hard, but understanding that when you are using a performance-enhancing drug, you're able to do more. You're able to be a little bit more reckless for the normal person, but these agents that you're using allow you to get away with it more because of how they help you recover most of the time. Not everything helps you recover, though, or not everything just helps you recover. The first thing we're going to start off with is things that do help you recover. Human growth hormone, also known as HGH, is probably one of the most effective things for true recovery. Now, what this stuff does, or a little bit about it first, HGH is actually produced by your pituitary gland in your brain. So it's something that your body naturally produces. Now, you're adding a synthetic version of it when you go and supplement HGH, but what it does is it strengthens your cells. Now, your cells include your muscles, tendons, ligaments, skin, hair, organs, anything that you are, it can strengthen. Now, there is some debate out there about whether or not it will strengthen cancer cells. There's not really enough research on that to prove or disprove that, but it's a little bit of information. Most of the people in my family have had cancer, and a lot of people in my family have died of cancer. So for a person like me, it could be a little bit nerve-wracking to potentially take human growth hormone. But from if you do your readings and things like that, the way that it will help you recover is pretty substantial. Now, HGH is something that you see a lot of people with AIDS take, and the reason that people with AIDS take HGH is it helps them survive the wasting phases of that disease. If your bones are denser, your muscles are denser, you're harder, you're stronger, all those cells are stronger, it's going to be able to survive more of a beating. The whole stronger people are harder to kill type of a thing. Well, stronger cells are harder to kill as well. So that's something to kind of keep in mind with that. But let me see. One of the things people don't realize, human growth hormone is used vastly across the world in children. Now, if you want your children to be X, Y, and Z, they can actually engineer human growth hormone to do different things. You see, China, for example, kicks the shit out of everybody in diving and in gymnastics and things like that. And these kids are like 14, 15 years old. Well, these kids have been running HGH from the womb basically until like 9, 10 years old, whatever age they are, when they're able to hit the Olympic age. Now, once you get to the age where you're able to start competing at the Olympic level, they start testing for these things. But before that, they don't. But these kids have 7, 8, 9, 10 years worth of benefits built up from using something like human growth hormone. And I mean, that's huge. That's staggering. Your muscles recover faster. You're more, you have better, you're going to get injured less. That's hugely beneficial for anybody. If your bone density, all the connective tissue, and the muscles themselves are all healthier, you're going to have a huge advantage, and they don't start testing until later in life. So, you wonder why these little kids are kicking the shit out of everyone in the Olympics? They've probably been running HGH for a while. You look at guys like, J.J. Watt or Brian Cushing on the Texans. The Texans are a huge HGH team, or they used to be before they started testing for it. The NBA didn't test for HGH, and then they started testing for it, and you just have a ton of dudes falling off, getting injured, and it's like, well, yeah, duh, they all got hurt. They all stopped taking this stuff. Like, that edge that they had in recovery was kind of taken from them. But HGH is a recovery thing. Certain people, you'll see a guy take like a whole bottle of it a day, and you start looking like Clay Matthews, and you start getting a huge forehead or a six-pack, but your organs have grown out. Not really what you want to do, but, different things for different people. So there's a little bit of background on HGH. We're going to move on, though, to testosterone. There's so many different types of testosterone, but the normal ones, test prop, cypionate, enanthate, and then there's a bunch of mixtures and things like that. But basically, testosterone is derived from cholesterol, and women actually synthesize it in smaller quantities than men, go figure. But everybody produces testosterone, and everybody produces estrogen. Now, as your testosterone level rises, your estrogen level rises with that, so it stays balanced. Now, that's why people will take an estrogen blocker when they are running testosterone, because the more estrogen in your body, it kind of counteracts the testosterone. Obviously, it's the opposite of what it is. So that's a huge piece to keep in mind with that and how that works. But people, say, oh, I'm going to get on a bunch of tests and I'm going to fucking go crazy. Like, okay, sure, fine. But that's not really how it works. Testosterone actually helps you recover more than anything. Now, the different esters, they get in your bloodstream from anywhere from a week to 3 or 4 weeks, just kind of depending on you and what ester it is that you are taking. But when it all comes down to it, this is not like a nitrous can that you put in your car and it makes it go super fast. This is more something that you use to help recover, and it's like taking your car to a mechanic or like changing the oil and keeping good oil in it. It helps you recover. It helps you have better endurance, helps you metabolize your food better. And a lot of times people with low testosterone levels, they're actually more obese because testosterone plays a big part in protein synthesis. So when your body's not getting those things, and then they add testosterone, a TRT type of a thing, to what they're doing, all of a sudden their body starts holding on to everything, and their body fat percentage goes down, their muscle comes up, and they're not just losing a percentage of body fat, they're actually losing pounds of body fat because they're getting out of a starvation mode. Now, you can take a ton of testosterone and get, huge, obviously, but you're also kind of putting yourself at pretty serious risk for injuries at that point. And that's where it comes time to be just a responsible human being with what you're doing to yourself, what you're putting in your body, because if you don't do that, you're not going to be around very long. So let's be smart with that. Moving on from testosterone, equipoise. Equipoise is actually like a high-grade anti-inflammatory, and this shit stays in your system for like 18 months. That's a very, very, very long time. But for people with tennis elbow and things like that, or pitchers and people with a lot of tendonitis, this is a great thing for them because it actually helps your swelling come down and it helps lubricate your joints. But if you don't keep your diet really healthy in that situation, you're going to add a lot of weight because it does stack weight on. It does cause you to gain weight. So you have to keep a very, very clean diet with that. A lot of people struggle with that, but that's okay. Going down the list here. Oh, okay, but equipoise. So basically, it helps your body move calories better as a result and can help in your athletic performance. So it is not only going to help you feel better, but it's going to help your body utilize the fuel that you're giving it. So that, in a sense, will increase performance, but it's not primarily a performance-enhancing piece in terms of like you take it and you're just going to get super strong. It's going to allow you to recover better, and there are some strength benefits to it, but mostly this is going to be something that allows you to recover, stay healthier, and utilize what you're putting in your body better. That's the most important thing you could ask for with anything that you take. Moving on, we're going to go to Anavar. Now, Anavar is commonly referred to as the women's steroid. So you see a lot of people take it, whether it be men, women, cancer patients, whatever it may be. You have a very, very, very wide range of uses for it. Now, you can abuse that just like anything, but this thing has minimal side effects. And if done correctly, you can get really good recovery and strength improvements from it without really any side effects. If a woman takes like 5 to 15 milligrams of this stuff a day, that's probably going to be really good. And if you're able to keep that level consistently in your bloodstream, you're going to have really good, healthy, safe improvements on it. But again, this isn't something that's just going to make you, blow up and be some huge, juice monkey. It's one of those things that allows you to recover, allows you to absorb the food that you are putting in your body better. And those are the most important things that you're going to hear a lot in this. And again, these aren't the exact scientific words, and I'm not trying to go all scientific. I'm trying to put this out there in a very understandable way for people. I'm tired of, the bro science and guys just talking out their asses using scientific terms, and then it's like, oh, yeah, this guy actually didn't really know what the fuck they were talking about. So I'm trying to avoid that. So you got Anavar, you got testosterone, you got equipoise, you got HGH. Something that falls in line with this stuff, though, and it's something that we hear a lot, is cortisone shots. Cortisone shots is for recovery, but recovery of a different sort. You get professional athletes and college athletes taking cortisone shots all the time. You get tons of people each year taking a cortisone shot just to get through the season, for example. Now, cortisone, though, is more like a bandage. It doesn't really do anything to help you recover. It just allows you to not feel the pain that you're experiencing right now. That's a very, very fucked up thing in my opinion. And I mean, keep in mind, I played in the NFL, I played college football and track. I did all the free agency stuff. You get beat up, and then they're like, well, instead of making you actually get better, we're just going to give you something that's going to allow you to keep on going. And there's some moral things with that, but that's okay. Everyone thinks cortisone shots are fine and they're good, whatever, they're legal, but they're probably one of the worst recovery drugs that you could take. And then all of a sudden, Anavar, equipoise, testosterone, HGH, all these different things, it's the devil. And it's kind of funny. It's a little bit of education and a little bit of open-mindedness. Like, steroids are, if you don't look at steroids as absolutely bad, and this is information about that, if you look at it differently, like, this is what a steroid is capable of, and then you make a decision based from there, all of a sudden, this quote-unquote bad thing isn't so bad. Now, I'm going to get into the things that give steroids a little bit more of a bad name, and those are performance-enhancing drugs like Dianabol, stanozolol, Trenbolone, Anadrol, Winstrol, some of those different things like that. That is the category of performance, like true legitimate. You take this, you're going to get fucking stronger and you're going to grow. Not so much focus on recovery. It's on the opposite end of the spectrum of stronger, faster, beats up your body, not good for your organs, and, you know, high risk, high reward. Not exactly what everybody wants to be taking on a consistent basis, and a lot of people need to take this, you know, 4 to 8 weeks at a time, 8 weeks at the max, and you got to really, really pay attention to your body on these things, because these are the things that will absolutely fuck you up. And when guys abuse these ones, this is what gives steroids a bad name. Outside of it fucking up baseball, because baseball, for whatever reason, is America's sport, even though it's the most boring goddamn thing in the fucking world. Whatever. This rant is brought to you by Monster. Sorry, Kimball. Not drinking Rockstar. Little bit of information about Dynaball. It's also known as D-ball. And this will cause big strength improvements. Some of the best powerlifters in the world, or strength athletes, it's the favorite fucking drug that they can take because it works. It works really good. It makes you dense, makes you hard, makes you stronger, and it'll pack on weight. Same thing with absorbing calories. It's very wet, so it will bloat you. Same thing I was just talking about. But it's a very, very easy compound for your system to digest, which is not normal for performance type of drugs. So pretty simple stuff there. D-ball, you know, you can take it with an injection, you can take it with oral pills or with oral liquids, and it kind of comes down to how much do you want to put your liver through, that type of thing. The next one, stanozolol. This is also known as Winstrol or Winnie. This will definitely cause strength improvements, help burn fat, and specifically targets your quick twitch small muscle fibers. So you see a lot of sprinters get in trouble for taking things like Winstrol. It will dry you out, so you're more susceptible to muscle injury, so you don't see it in powerlifting quite as much. But for bodybuilding and some of those, you know, football type sports where explosiveness and quick twitch muscle fibers are the more important thing, it's pretty fucking rampant. It helps make you more explosive if you train as an explosive athlete, but like I said, it will dry you out quickly as it burns fat, so it's a good fat burner. One thing that people experience with this is headaches, because you will get dehydrated. If you don't drink a stupid amount of water on this, you will dehydrate, you will get a headache, it will not feel good. So a little information on that. But that's also your body saying, like, shit, like, I might not like this totally. It's a dangerous substance. It is what it is. Moving on to the next one. Trenbolone. Tren. This is fucking horrible. Very, very effective, but it's a horrible fucking drug. It's used for big strength gains and body recomposition. This shit will help you cut fat, grow muscle, do all that shit, make you stupidly strong. This one definitely will make you more aggressive. This is one of the steroids that you can't really argue like, oh, Tren won't make you a little bit more aggressive or give you a temper. Like, no, it probably fucking will. So if you're going to run that shit, you need to make sure that you're not being a fucking douchebag to everybody in your life. Because it does do that, absolutely. But this can increase insulin sensitivity to use fat as a source, which means it does burn fat, but you're flirting with increasing sensitivity to insulin. That is very, very dangerous. Again, high risk, high reward. Be careful with this one. This is a very, very, very dangerous drug, but it's a very, very effective drug, and this is why a lot of people are here for a good time, not a long time with different strength sports, and you see them, they overrun it, and then their receptors aren't doing anything with it, and it's just shitty. So that's what it is. Last one on this, Anadrol. It's good for strength and size, but it's very hard for your body to process. Very hard for your body to process, no matter what form you get it in. Your body's gonna struggle putting this shit out, figuring out what to do with it, and how to absorb it correctly without livers and kidneys and shit like that just getting pissed off, falling apart. You need to take a metric fuck ton of milk thistle or something like this. This will definitely increase your aggression, and it will increase your strength fast. But again, hard for your body, aggression problems, but you'll get stronger. So high risk, high reward. That's what a performance. That's the NOS tank that you're putting in your car to make it go super fucking fast. You might blow a gasket. You might get a fucking felony. You know, you don't know what you're going to do with it, but it's going to make you go super fast or be super strong. And welcome to America. That's what everybody wants right now. So I'm not going to go through every single substance, but there's a group of 4 or 5 recovery agents and 4 or 5 performance agents. Do not forget, this shit will not replace work ethic, okay? It will not replace work ethic. It will not replace talent. you have to go fucking work. And you have to have some form of a foundation in order for this shit to really be successful. You can't go from, a normal muggle running around at, 5'8", 180 pounds and dad bod to a, 5'10.5" 280 pound fucking god over 2 years because you got on steroids. Like, that's just not how it works. You can lose a lot of weight very naturally. That's one of the reasons that we actually did this video. Every time we post a transformation of a client, someone has a chipper ass little retarded comment of, oh, must be fucking running something. Like, no, motherfucker, they're just more educated and they're more dedicated than you are, so shut the fuck up. You don't have to blame it on a steroid. It could just be very possible that this person worked harder and was smarter and was more dedicated than you were, you fucking troll. So, that's why this video is coming out. I'm tired of people saying like, oh, blah, blah, blah. Like, no, fuck you, motherfucker. Because if you don't work on this shit, you're actually probably going to get fatter. If you don't work on this shit, you're probably going to fucking fall apart really quickly. And it's a huge waste of money. But I'm not sitting here saying, oh, you should take these and these are what you should take. Here's just some fucking legitimate information in layman's terms, really easy for you to understand how this, that, and the other thing works. Figure out where the fuck you need to draw the line, though. If this is something that you are doing or you're thinking about doing, figure out where the line is for you. You don't want to cross this, because anything you take is going to help you in one way or the other. Even if you take it in small dosages, sometimes people need to take 250 milligrams of testosterone split into 2 shots a week, so 225 milligram shots of testosterone, just to get their test levels back up, and then all of a sudden they're feeling better. A 45-year-old feels like he did in his 20s again, and he's eating his food better. Not only is his appetite improved, but his ability to absorb the food that he's fucking eating is improved. Test levels go up, sex drive goes up, your mood increases. Obviously, if you're having more sex, you're probably in a better mood, but those are not related. That is just a coincidence. So all these things will get better. Just because you have to get on TRT doesn't mean it's a bad thing. Testosterone is not bad. Steroids inherently are not bad, but when people abuse anything, it's bad. We're going shooting right now. Guns aren't bad, but if I go kill somebody with it, okay, like, that was stupid. I chose to do something irresponsibly, and that's what happens with it. So anything good can be bad, but that doesn't mean that anything good, it's only going to be good if you use it in the right way. That's what I'm trying to say with this stuff. So hopefully this shit was helpful to some of you guys. I know we're going to get a bunch of shit talked about it. I know I'm going to have like 40 people in my inbox like, hey, bro, can you hook me up with some shit? That wasn't the point of this. The point of this was to throw out some information and take it or leave it. We're just going to delete stupid fucking comments. We're just going to block stupid fucking people saying stupid shit. But hopefully this helps more people than it pisses off and offends. So hope you guys are having a wonderful coronavirus quarantine. This motherfucker's almost over. We're going to be back in the gym soon. And now you guys have a little bit more information on a baseline of how steroids work, and it's not all scienced up. If you guys have questions, feel free to hit us up. We will talk to police about how it works. We will talk to anybody who wants to know just how some of this shit works, a little bit more about how it fucking works, so we can educate more people and maybe take some of the bad spotlight off of this shit. Sorry it ruined baseball. That's the only reason people are as pissed off as they are about it. So talk to you guys soon. Thanks.